Hello, ladies and gentlemen. This is the 10-minute lecture for hepatic disorders. With hepatitis, please remember that incidence and prevalence is worldwide, and it is associated with individual behavior and their exposure to toxins. Several viruses can cause hepatitis. Transmission is through either fecal, oral route, or directly through blood and body fluids. Some other risk factors are chronic alcohol use, exposure to some prescription and over-the-counter medications. So with hepatitis A, that is the most common type. It is primarily spread through the fecal oral route from food, water, or shellfish. And whoever is preparing it may have used the bathroom and they did not wash their hands, or they didn't wash their hands thoroughly. It is also spread through close contact with an infected person or unsanitary conditions in the home. And in relation to foods, it can be destroyed by cooking. Hepatitis B is spread by blood and body fluids such as semen. It can be spread through the mucous membranes, contact with infected fluids, during childbirth, or through a skin puncture. Patients will have acute or chronic infections. There is a vaccine for hepatitis B, and that is required for all healthcare personnel. Hepatitis A and B vaccines may be required for daycare, elementary schools, and middle schools. And some other risk factors will include sexual contact with infected persons, IV drug abusers, someone who has experienced a blood transfusion. The incubation period is 4 to 10 weeks. It is diagnosed with elevated AST and ALT levels. Hepatitis C is spread through blood or body fluids, contaminated needles, and also from tattoos, body piercings, especially if it's done in an unclean tattoo parlor, piercing parlor. There is a table, 59.4 on page 1460, vaccines for hepatitis, and please know that table. There is also on page 1465 a table for, or a safety alert for caring for a patient with a liver biopsy. When we are talking about cirrhosis, we are now moving into cirrhosis. So again, on page 1465, there is a safety alert for treating a patient with a liver biopsy. And then other treatment for cirrhosis will include the Seng, Stake, and Blakemore tube. And we will use this, or a doctor will insert this, if there is uncontrolled esophageal bleeding. And so he is going to it will go down through the nose, and it will provide compression and traction in the esophagus and stomach to stop the bleeding. This is also called the balloon tamponade. Some complications of this procedure are airway obstruction, esophageal rupture, and aspiration pneumonia, because this tube can travel. It is only held in place for a very short time. The purpose is just to keep it in place long enough to stop the bleeding. There is a safety alert on page 1465. Please know that safety alert. And then also management of these patients with hepatic encephalopathy will include avoiding protein overload, decreasing production of ammonia, and correcting fluid and electrolyte imbalances. So doctor may prescribe lactulose, and lactulose is a medication that will decrease the production of ammonia and will promote the excretion of the ammonia in the stool. Other clinical manifestations of cirrhosis include metabolic alkalosis, and this is due to vomiting, fluid loss, diarrhea, and diuretics. Some nursing interventions for cirrhosis are to monitor the respiratory status for shortness of breath, We are going to monitor those vital signs. Now, blood pressure may be elevated or the patient may be hypotensive. So the blood pressure may be elevated because of fluid excess, fluid overload. And they may be hypotensive, due to their decreased albumin level. We are going to monitor INO because of fluid retention, and for the same reason, the patient will be on daily weights. And again, we are going to monitor this patient for acid-base balances, to monitor for metabolic alkalosis, because due to the fluid loss, vomiting, use of diuretics, diarrhea, this patient can go into metabolic alkalosis. And some nursing actions for a patient with cirrhosis is to administer diuretics, perhaps maybe some magnesium or phosphate, however doctor orders. And also we want to make sure that we pull back on their sodium and their fluid intake. Their serum creatinine level will be elevated because of the damage to the kidneys, but their sodium level will be decreased. They will have a decreased sodium level. Again, ladies and gentlemen, thank you for your time and attention. And if I can help, please reach out.